The Alexander Technique, An Approach to Health and Well-Being by Dr. Rohit Deshpande. The Alexander Technique, named after its developer Frederick Matthias Alexander, has gained attention as a type of alternative therapy focused on addressing health problems through improved posture. This technique, considered a complementary approach when used alongside mainstream methods, has garnered interest from individuals seeking relief from various conditions. However, despite claims made by proponents and teachers, there is a lack of robust scientific research to support its effectiveness. Frederick Matthias Alexander, a Shakespearean reciter, developed the principles of the Alexander technique in the 1890s. His own struggles with voice loss during public speaking motivated him to explore methods for overcoming this issue. Through self-observation and experimentation, Alexander discovered that conscious awareness of one's bodily movement and the release of tension could improve both posture and overall physical functioning. He credited his technique with enabling him to pursue his passion for performing Shakespearean recitations. The Alexander technique is primarily taught through private lessons that typically last from 30 minutes to an hour. The number of lessons varies depending on the student's needs and level of interest. Students often include performers such as actors, dancers, musicians, athletes, and public speakers, as well as individuals who work extensively with computers or experience chronic pain. Instructors observe their students and provide verbal and manual guidance to help them develop better poise and move with less strain. The sessions involve chair work, where students learn to maintain a comfortable alignment of the head, neck, and spine while standing, sitting, and walking. Table work or physical manipulation may also be included. In the United Kingdom, there is currently no regulation governing who can offer Alexander technique services. However, professional organizations do exist, typically offering 3-year courses to individuals seeking to become certified instructors. Proponents of the Alexander technique believe it can address a wide range of health conditions. However, there is limited scientific evidence to support these claims. As of 2021, the UK National Health Service acknowledges that the Alexander technique may be helpful for long-term back pain, long-term neck pain, and coping with Parkinson's disease. Nevertheless, both the American health insurance company Athena and the Australian Department of Health have conducted reviews and concluded that there is insufficient evidence to support the health claims of the technique. The influence of the Alexander technique extends beyond the realm of physical health. American philosopher and educator John Dewey, impressed by his personal experience with the technique, wrote an introduction to Alexander's book Constructive Conscious Control of the Individual in 1923. Fritz Perls, the originator of Gestalt therapy, also credited Alexander as an inspiration for his psychological work. In terms of application, the Alexander technique is often used as a therapy for stress-related chronic conditions. While it does not aim to cure the underlying causes, it focuses on teaching individuals how to avoid habits that may exacerbate their condition. Additionally, it has been employed as an alternative treatment to improve voice and posture for individuals in the performing arts. Regarding the health effects of the Alexander technique, the UK National Health Service acknowledges evidence suggesting its potential benefits for chronic back or neck pain and Parkinson's disease. However, evidence is limited for conditions such as asthma, headaches, osteoarthritis, difficulty sleeping, and stress. A review published in BMC Complementary and Alternative Medicine in 2014 concluded that the technique may help alleviate performance anxiety in musicians but found inconclusive results regarding music performance, respiratory function, and posture. A 2012 Cochrane systematic review stated that there is no strong evidence supporting the effectiveness of the Alexander technique for treating asthma. Utna, in their 2021 review, considers the technique experimental and investigational due to inadequate evidence. The Australian Department of Health's 2015 review also highlighted limited evidence and uncertainties about the technique's effectiveness and safety. It noted that while the Alexander technique may improve short-term pain and disability in individuals with low back pain, the longer-term effects remain uncertain. Based on the available research, it is clear that more rigorous scientific studies are needed to establish the effectiveness of the Alexander technique in treating various health conditions. The limited evidence and lack of replication of results underscore the importance of further investigation. Despite the current gaps in scientific understanding, individuals continue to pursue the Alexander technique for personal development reasons. Many find value in the technique's emphasis on body awareness, improved posture, and conscious control of movement. The holistic approach of the Alexander technique, focusing on the mind-body connection, appeals to those seeking a more integrated and mindful approach to their well-being. In conclusion, the Alexander technique, developed by Frederick Matthias Alexander, offers an alternative approach to health and well-being through improved posture and conscious movement. While proponents and teachers believe in its potential to address various health conditions, the scientific evidence supporting its effectiveness is currently limited. The technique is commonly taught through private lessons and appeals to performers, individuals with chronic pain, and those seeking personal development. It is important for individuals considering the Alexander technique to approach it as a complementary approach and engage in open communication with healthcare professionals. Further research is necessary to ascertain its efficacy and safety for different health conditions.